Hi friends, Auntie Angeline here, and I am back with Dr. Georgia.
Hi, thanks for having me.
Thanks for coming. We spoke in the summertime about summertime sickies, and now we're approaching winter, and I just thought of you because I just got over being sick. So tell us what we're going to talk about today.
Yeah, definitely. Well, you're definitely not alone there. We're seeing a lot of colds and upper respiratory illnesses in the offices. So we're going to talk about all the different kinds of things that are circulating right now. We'll talk about how, to kind of feel better when you're not feeling very well, preventive ways, preventive measures, both vaccines and some of the different hand washing and other techniques you can use to keep yourself from getting sick, and anything else that happens to come up. Just a quick medical disclaimer. I am a medical doctor, but not your doctor. So this is for general information, but not for individual medical advice.
Amazing. So what is circulating this winter?
Sure. So we have seen a lot of flu already in the office. We've seen actually across the state of Florida an 80% increase in the last year. So not just from the fall and the spring, but the whole year of pertussis. We are seeing, the occasional COVID or something else pop up like paraflu. And then the other really big one that we're seeing more and more of, and that's going to continue through the winter, is RSV. And we can kind of talk about those individually too if there's any particular ones that you're wondering about.
What does RSV mean?
Sure. So that one, I think maybe if you don't have a little baby or you don't have somebody who's medically vulnerable at home, might be a little bit more, kind of a new term. It stands for respiratory syncytial virus. It's responsible annually for lots and lots of hospitalizations in very young infants. So usually kids under age 2 and more common in kids under 6 months. But it can also impact people who are older, so over 65, people with weak immune systems for whatever reason, whether they're undergoing treatment or they were born with problems with their immune system, or people with heart and lung conditions. And those folks can end up in the hospital with this, and it can be quite severe. We see outbreaks in, again, young infants, nursing home residents, things like that. For the youngest infants who I take care of, our biggest worry is apnea or pauses in breathing that can cause kids to have to stay in the ICU for prolonged periods of time. So it can be really dangerous and really scary for families that are having to deal with that.
Yeah. So with families, I know we have a lot of parents and guardians watching, and maybe a lot of new parents. So what are some things that they could look out for in terms of, like, is it just infants that would get this? Can they contract it too?
Yeah, so parents will oftentimes get it. It's not as severe with adults, but usually it's the things you would think of with a cold. So runny nose, cough, a little bit of trouble breathing. And again, with infants, they're going to have those more severe symptoms. So what that might look like is using extra muscles to breathe, breathing at a faster rate, things like that. And you can talk to your doctor about some of those signs, but it can be very scary as a parent, for sure.
So I'm of the mindset like, I can't get it because it's a child's disease or sickness. So how can we prevent getting these sicknesses?
Well, for all colds, we want to be mindful of how we're sharing germs. So things like wearing a mask when we're sick, not going outdoors, staying home as much as possible when we're not feeling well. With RSV in particular, hand washing is also important because it can exist on surfaces. And we can talk a little bit now or later about best hand washing techniques and things like that. And then something really amazing for RSV for those who have young infants and for pregnant women when are going to have a baby during RSV season, there's 2 things that they can do that are really exciting. So there is an RSV immunization that mothers can get later in the pregnancy in the 3rd trimester, and that immunity gets passed on to the fetus before baby is born, before baby arrives. If moms are not able to get it, then there is an RSV immunoglobulin that you can get either at your pediatricians, or I imagine some newborn hospitals are doing that as well. And you can talk to your doctor about those. And we are already seeing, even though the first rollout of this was in 2023, so just a couple of years of data, really amazing reductions in hospital admissions for newborn babies and young infants who used to get RSV and end up in the hospital all the time. So it's really exciting.
Oh my goodness. Yeah. So this is a fairly new thing, and I'm so glad you're bringing that to our attention. That's amazing.
Yeah, it was something I really commonly dealt with when I worked as a hospital physician, so someone who worked in hospitals. And when it came out, my son was just a few weeks shy of, where he would have aged out of being a candidate, because you can only give it up to 8 months. And I was knocking at the door of my pediatricians asking for it. So we made sure that he got it, and I would definitely, if it's available to you, definitely recommend it.
So not to scare anyone, but what does the most severe case of RSV look like?
Typically, younger infants who I care for would be, having pauses in breathing that may lead to cyanosis. So anything that, you're seeing discoloration, purple, blue, dusky appearance of the lips, you're going to call 911 right away. Rapid, heavy breathing, more broadly, that impacts baby's ability to feed or makes baby totally inconsolable. Those can be signs that baby's really getting quite sick. But generally, those are kind of some of the signs that things might be getting more severe. Some babies will get fever with RSV as well, and that can also kind of make everybody look a little bit sicker. When we have a fever, we have a higher metabolic rate, so we're breathing a little bit faster, our heart beats a little bit faster, and sometimes mommies notice that, and that can be scary. And one of the biggest things is that can cause babies to not feed as well, kind of like we alluded to before, which can lead to dehydration. When babies get dehydrated, it typically happens very fast, and they may need IV fluids or things like that to recover. So if you're seeing anything like that, so a decrease in wet diapers, usually I tell parents, if looking for wet diapers, if they're seeing half of what they usually see or no pee in the diaper in more than 9 hours, that's a sign that you need to go to the emergency room. And again, those pauses of breathing that we talked about.
Wow. So let's talk about that hand washing that you said earlier. What's that about?
Well, with RSV and lots of other infections, by the way, we want to wash our hands as much as possible. So typically, there's a technique that you can use. You want to make sure you're not doing it too quickly or too hurriedly. I tell my kids to make sure that they're using soap, lathering up that soap, and then they're going to be rubbing their hands for 20 seconds, about the length of the ABC song. So we just sing ABCs at the sink. And we want to kind of rub the fingers this way. We want to make sure we get our thumbs. We want to make sure we're getting in between the fingers, the palms of the hands, and the outside as well. And so once we've done that and rinsed off, that's a good hand washing technique when we wash for at least 20 seconds. The other thing we can do is, making sure that we're covering our mouth when we cough or sneeze, which can be hard for our youngest kids, but making sure that we're coughing or sneezing into the elbow so that we're not getting those germs on the hands, because that can also cause, obviously, transmission of these infections.
Okay, so let's talk about immune support. What can we naturally do to boost the immunity?
There's a lot that we can do that, doesn't really take a whole lot. So some of the studies, bear in mind, have been looked at in adults, so maybe less applicable to kids, but for adults, they've looked at exercise, at least 150 minutes of cardiovascular exercise a week. That means our heart is really pumping, we're breaking a sweat, has been shown to boost immunity. Getting a good night's sleep. If you have had a rough night's sleep before, you know that the next day you feel like you could kind of fall ill at any moment, and that's really true. Our immune system needs 8 hours of sleep for adults, and for kids even more sleep to really function properly. And then other things like drinking plenty of water and kind of making sure that we're taking our liquids. That's really, really important as well.
I think people underestimate sleep. I know for me personally, I'm always sick. I always have to have my vitamins and at least get 8 hours of sleep. And if I'm having a week where I'm just working or just not getting enough sleep, it'll just run me down. And the second I hear a cough next to me, I'm out for 2 weeks. So I think that's definitely something that we can all learn to do more, is like a little self-care just to prevent anything, because your girl gets sick a lot.
Well, chronic stress can also impact our immunity. So if we're feeling lots of stress, whether it's from a job or another aspect of our life, that really can impact how often that you get sick. So you're pointing out a really good kind of something that really bears through with the science.
Yes, we were trying to figure out what was going on, why I was getting sick all the time, and like every month or so I'd get a cold, and so I just made a few changes like you said, and now I'm hopefully just getting sick like once or twice a year instead of almost every other month. So
good. Yeah, it's no fun being sick.
No. So another thing I do is I get a lot of B12 shots injected. Talk to me about like what other vitamins I should be taking.
Yeah, I think a lot of patients and families are wondering about this because there's everywhere you look, lots of advertisements for vitamins, minerals. From the start, the most important thing that you could do to boost immunity is a balanced diet. So eating a nice mix of complex carbohydrates, whole grains, vegetables, fruit, and protein, and making sure that you have all of those in your diet, as well as calcium sources like cheese, yogurts, things like that. That alone is going to make a big difference, is eating a balanced diet rather than tons of highly processed foods or snacks and things like that. But setting that aside, there is some research about certain vitamins and minerals, and it can be a little bit complicated. So I guess we should probably take one at a time. Should we start with vitamin D?
Sure.
All right. Without getting into it too much, there have been studies that have shown that if you have low vitamin D levels, you're more prone to infections. Now, on the flip side, they've done studies where they supplemented with vitamin D, and the data on that was a little bit less clear. So making sure we have adequate vitamin D levels in the diet from various sources. Maybe it's helpful. If you want to take a supplement, you can. If you want to talk to your doctor about, whether or not it's a concern of yours. But remembering that we're getting, we get that from, different things in the diet that similar to our calcium sources, and also having, nice natural sunlight with, the time that we spend indoors and the time that we spend using sunscreen. That's kind of a flip side of it.
Right.
So still use your sunscreen, but make sure you're getting some of vitamin D levels through that as well.
And in other parts of the world during this time, they don't see the sun as often. So taking those supplements would probably definitely benefit those people that don't see the sun as much in the winter.
Yeah, it's something that we recommend for all babies. So newborn babies, we typically recommend to be supplemented with vitamin D until they're getting a certain amount of formula, or if they're breastfed, it's just not available in breast milk. And then for kids, there's a slightly higher dose that's recommended. You can always talk to your doctor about, what best sources of those kinds of things. So,
and last question. How do we shorten these colds if we do get sick?
Good question. And again, there's lots of different supplements out there. I just generally a good recommendation to just touch base with your doctor before you take anything, especially if you're getting it from an unknown source or a little bit of a tricky source like Amazon. I prefer to go to pharmacies if I am going to get a supplement. The only other one that has shown to have some kind of benefit is vitamin C. So vitamin C taken regularly has been shown to shorten the severity and the course of illness. So meaning you could shorten it by a few days. One other trick that can shorten the duration of illness, if you do it early enough, is saline drops in the nose and just making sure we're getting good nasal clearance if you've got a lot of runny nose or cold symptoms. So those are the two that have been shown to, kind of have a clear benefit. There are some studies on things like elderberry, which people ask me about a lot, but the data is very, not clear on that. So
what about zinc? Did we talk about zinc?
Zinc, this is another very interesting one. So the most robust data that we have on this is in children in low-income countries, meaning countries where their parents might not have enough to buy them food and they may have malnutrition, so problems with low nutrition that are much less common in the United States. Now, in these children, if they have a diarrheal disease or an infection, they're offered zinc. This is part of the World Health Organization guidelines, and it does shorten the course of illness. Here in the United States, where kids tend to have adequate nutrition, they have access to food, whether it's because their parents are, able to kind of get access to those things, or they're on WIC or SNAP or things like that. The data, again, is less clear, but overall, the most important thing that you can do for yourself or your child is offer and eat a balanced diet.
Amazing. Well, thank you so much for helping us stay away from sickies or shorten the sickies. And I have loved having you on today.
Yeah, happy to chat. It's something I'm talking about every day in my clinic. So yeah, definitely happy to help.